The disorder that I have done my presentation on is XSCID, or X-linked severe combined immune deficiency. So what is XSCID? Most commonly it's known as bubble boy disease. XSCID is caused by a mutation in the IL-2RG gene located on the X chromosome. Patients with XSCID have little to no immune system. The most common symptoms are a severe increase in disease susceptibility, failure to thrive, lack of response to antibiotics and vaccines, and an increased risk of death by infections. XSCID is a fairly rare disorder, less common in females because of their second X chromosome. Only 40 to 200 children are diagnosed each year in the U.S., but they are commonly diagnosed at 6 months when they fail to thrive. There could be many XSCID children out there who have died of ear and eye infections before they were diagnosed. So what is IL-2RG? It is known as the common IL receptor, but its true name is the interleukin-2 receptor gamma chain. It is a transmembrane protein with extracellular and intracellular domains. IL-2RG normally acts in all of these different IL receptors. It dimerizes or trimerizes with other IL receptor chains. It acts in B cells, NK cells, T cells, monocytes, and granulocytes, nearly all of the immune response cells. A mutant IL-2RG has no activity in any of these receptors, which means that it has decreased activity of the B cells, T cells, NK cells, monocytes, and granulocytes, creating a severely depressed immune system. The experiment that I propose is to work with mice to find out what the IL-2RG exactly is binding to. Why mice? Mice have an analogous cytokine pathway with the same genes and immune system cells as humans. Mice also have the same XXXY sex chromosome system as humans, and the mouse system is well known with a database and research available. The first thing I would do is look into that research. I would check the data on the IL-2RG gene, find out if anyone studied it and what they did and what they find. For the purposes of this presentation, I looked into all three of these resources. Second thing that I would do is perform a yeast-2 hybrid study. I would find a reporter gene that fit my system. Then I would bait it with the IL-2RG gene, and the prey would be other IL-associated receptors. Hopefully, I would find a few that will multimerize with the IL-2RG gene. Then I would find if the IL-2RG gene was necessary and sufficient to bind to these different receptors. Using a genetic approach, I would do knockout studies to see if the IL-2RG gene is necessary to bind to the various IL molecules. Using a biochemical approach, I would perform a protein co-immunoprecipitation study to determine if the IL-2RG is sufficient to bind to various IL molecules. Through both of these, I hope to figure out what exactly the IL-2RG is binding to. This is a list of my references.